You did touch on failed embryo development. Can you please explain how we can improve on that in future cycles?
Yes, in patients with a failed embryo development, we should really try and understand what is actual cause for failed embryo development. So for that, we need to look at the major parameters. So first, we look at the baseline fertility. So baseline fertility means, so each couple have got unique baseline fertility. So this is made up by major fertility factors. On female side, mainly female age and egg reserve, and overall health also, but mainly female age and egg reserve. And male side, sperm concentration, which is number of sperm, and quality of sperm, that's generally motility and morphology of the sperm. So you look at this baseline, and if they don't have any major issues on the baseline, and then you look at how many embryos they produced. So if they had a good number of embryos, let us say 8, 10 embryos, then if they had a failed embryo development, you should try and understand, is it because of primarily due to egg or primarily due to sperm? Both of them have a contribution, but generally egg has got more contribution. Generally 80% of contribution comes from the egg, generally, provided sperm quality is normal. If sperm quality is very poor, actually maybe sperm is negatively contributing to poor outcome more than egg. So then you look at the where embryos stop developing. If embryos stop developing very early on day 1, day 2, which means only in 1 cell or 2 cells or 3 cells or 8 cell stage, then very likely a lot of problem coming from the egg quality or egg maturation. Why? Because sperm becomes activated from the day 3, day 4. So first 3 days embryos run on the genome of the egg. So egg provides with all the information, all the nutrition, all these conditions to grow and multiplication of the embryos first 3-4 days. Sperm, until it gets activated, it takes few days. So if embryos were growing fine, when you look at on day 5, if embryos, all of them, like most of them, stopped on day 4, then it indicates the embryos were growing fine. As soon as sperm DNA got activated on day 4, they stopped. So that indicates actually very likely there's a lot of contribution coming from the sperm. If embryos stop developing, most of them on day 5, then very likely it could be due to egg primarily again, or sperm. Why? Because when sperm got activated, embryo kept growing and become blastocysts, then they start degenerating or they stop developing. So that indicates probably it's mainly due to egg and possibly due to sperm. So this is not very clear cut because both egg and sperm plays important role in embryo development. So we need to take a look at the big picture. Egg is more responsible generally. Generally first few days eggs mainly responsible. So if embryos stop on day 4 in transition from morula to blastocyst, then it's very likely due to sperm factor. It played an important role. Then if it stopped on day 5, it could be due to egg or sperm, but mainly due to egg. But this is in the very overall big picture. But in terms of individual embryos stopping development, we cannot tell. So it could be egg or sperm. So it's impossible to tell unless you do research and just track back to their chromosomes and understand where you had an error. Embryos stop developing generally if there is a chromosome error. So embryos should have a 46XX chromosome or a 46XY chromosome. If you have extra copies of chromosome or less copies of chromosome, generally these embryos are not fit to become baby and they stop developing early on. So, and this chromosome error mainly originates from egg, not in individual couples, not in individual embryos, but generally. We are generalizing in the human population. Embryos usually stop developing due to eggs. So, but in individual couples, the contribution of sperm may be more, especially if sperm quality is poor and egg quality is good. So, but yeah, so let us say in 10 embryos, so overall we can tell and make an assumption. Yeah, so it's very important to understand. It's not exact science. Make an assumption. Look, let us say you had a failed embryo development. You had 10 embryos, none of them become utilizable. That's a very poor outcome. Then you need to try and understand, is it because you had a more problem in the sperm or more problem in the egg side. So looking at the when embryos stop developing on the baseline female age and egg reserve and the male sperm parameters, then you make an assumption. You can say it looks like primarily we had a problem with eggs. Is it because of egg maturation or egg quality? Looking at the chart, you can tell whether there was issue with the maturation or quality, or is it because of sperm? So usually we can give an estimate. So let us say out of 10, possibly 70% didn't develop because of eggs and 30% didn't develop because of sperm. So this is assumption of fertility specialists after reviewing whole cycle. So we do this during the cycle review and tell. But if you have a low number of embryos, not 10 embryos, let us say you have got 2 or 3 embryos, if they stop, if you don't get any high grade embryos, it can be just due to chance, because you're playing with, you're using small number of embryos. Let us say you had 2 embryos, statistically you should get maybe 1 out of 3. If you only had 2 embryos, if none of them become high grade, so it could be due to egg and sperm or both, but here it just the quantity was so low and likelihood of failed embryo development is high. Likelihood of failed embryo development goes down as you get more eggs and more embryos.